What steps can hospitals take to reduce pollution-related? Air pollution inside hospitals is a surprising threat after surgery. Tiny particles and harmful gases can enter your lungs and slow healing. To combat this, many hospitals install high-efficiency particulate air filters, or HEPA filters, which trap pollutants like dust, bacteria, and chemical fumes. Enhanced ventilation systems also push fresh, clean air through surgical and recovery spaces, reducing contamination. These upgrades help create a safer environment for your body to recover quickly. Cleaning is critical in hospitals, but many disinfectants release volatile organic compounds, or VOCs, which can irritate your lungs and delay recovery. Progressive hospitals now switch to greener cleaning agents with fewer harmful chemicals. They also carefully control when and where these products are used, ensuring patients recovering from surgery avoid unnecessary exposure. This shift not only protects your healing process, but also improves overall indoor air quality. Medical waste, from used gloves to surgical tools, can release dangerous pollutants if handled poorly. Hospitals reduce pollution-related risks by following strict protocols for sorting, treating, and disposing of these materials safely. Some facilities use autoclaves to sterilize waste and avoid harmful incineration emissions. This careful management stops toxic substances from contaminating air and water, protecting both patients and the environment. Hospitals don't just install equipment and hope for the best. They continuously monitor air quality and pollution levels with sensors that detect harmful particles and gases in real time. Staff receive training on pollution prevention best practices, from handling chemicals to maintaining clean environments. This vigilance helps identify and fix pollution sources immediately, keeping your recovery area safe and clean. Subscribe for daily answers to questions you didn't know you had.